and then you bend forwards as far as you can. And I'm gonna push it sort of down at an angle towards the floor. But I'm gonna swing my knees over to one side, and I can feel it stretching on my lower back. I'm gonna hold that for about 3 to 5 seconds. Hi, I'm Dr. Michael Pasternack, a chiropractor with Winchester Spine and Injury Apple Wellness Center. Today's video is going to be my top 3 lower back stretches. So one of the things I do here in the office is I do specialty work for car accidents, and I fill a niche that I like to call quarterbacking. The reason that's important is, and the reason I want to show you these exercises is, you may not realize this, but 47%, so almost 50, 47% of the people involved in a car accident are still going to have significant complaints even 30 years later. And so it's really important that we manage these conditions properly. And so part of that is, rehabilitating the spine and doing exercises. The other part is getting early care and the proper care, and that's sort of what I do with my quarterbacking. I talk about that on another video a lot, but just really briefly, quarterbacking means that I'm sort of managing what's going on, making sure all the I's are dotted, all the T's are crossed, that you're going to the right providers at the right time, and so it's what I do that builds really incredible value to help patients get the best results. So my top 3 exercises, the first one I'm going to call well, it's a simple bending forward. So I'm going to demonstrate it for you now. My pants are, they're loose so I can move around. You could say baggy. But I'm bending my knees a little bit. That's important. So when you're doing this, you're going to bend your knees a little. I'm exaggerating, but instead of being straight, I'm bending it just a little bit. So you bend your knees a little, and then you bend forwards as far as you can. Notice how I'm not bouncing, I'm just holding it. And actually, wow, usually I can go further than this. Today's a pretty tight day. But you just hold that for about 30 seconds to a minute. And you're gonna feel it stretching in the back of your legs and the back of your thighs. So this exercise is gonna help a lot if you're having problems with standing. The second exercise I'm gonna show you is a combination between 2. I call it kneeling and praying, because you're sort of doing both. So the first part is you get on all fours, and then, for lack of a better way to say this, I'm going to take my backside, my butt, and I'm going to push it sort of down at an angle towards the floor. So I'm pushing back as far as I can, and I can already feel it stretching over on my lower back. The second part is now I'm going to start reaching forwards, almost like I'm praying or grabbing forwards. So I'm still pushing down with my backside, but I'm also reaching forwards as far as I can. And I can feel a pretty good stretch with that. And so again, you're just gonna hold that for probably about 60 seconds. I have so many stretches that we work on with patients in the office. It's really hard for me to just pick the top 3. So I'm battling with myself. What's the third one I'm gonna show you? But I think I like this one, at least for today. So you lay on your back. And you could do this on your bed. I just don't have a bed here. And so you bend both of your knees, and then I'm gonna leave my shoulders where they are, but I'm gonna swing my knees over to one side, and I can feel it stretching on my lower back. I'm gonna hold that for about 3 to 5 seconds. And then again, leaving my shoulders down, I'm twisting my legs and my hips to the other side, and I can feel that stretching. And you hold that 3 to 5 seconds. And you don't have to go quick, and you keep doing that, and as you do that, you're gonna feel one or both of those sides start to loosen up. It gets easier to do. Exercises, I was saying, are important, and so the reason I specialize in car accident stuff is because I don't like that statistic that I was mentioning, that 47% of the people still have aches and pains, or significant aches and pains, even 30 years later. So I do everything I can to help make sure we get the absolute best results early on. The earlier on we can start treating things, the less scar tissue there is, the better result we're going to get. So, Dr. Michael Pasternack, chiropractor. I'm going to say quarterback because that's what I do for my car accident cases as well as everyone else. If you have any questions or comments, feel free to leave those. We'll get back to you. If you've been injured, whether it's a car accident or something else, or you're just having neck or back pain, well, if you're here locally, well, come in and see me. Let me help you. If you're not here locally, well, find someone that's as qualified as I am and go get the help you need. Follow us on social media and share this video with someone else that it could help. Dr. Pasternack, have a great day. Thanks.